as a therapist, someone who has gotten therapy themselves for years, and as someone who's worked with other therapists, I am here to tell you that some therapists do not know how to help you, but they won't tell you that. Therapists, similar to doctors, usually have things that they specialize in, areas that they love to see clients or patients in, where they're really good at, where maybe they've gotten some advanced training, or they have some personal experience, or both, ideal, and they're very familiar with seeing this type of client with this kind of presentation, aka this kind of problem. However, a lot of times there are more clients than there are clinicians, which is why, side note, I'm accepting new clients. If you are a trauma survivor, especially if you've dealt with childhood trauma recovery, that's my specialty, or self-care issues, which a lot of trauma survivors do struggle with, make sure you check out the link. There are links and information about my services as well as my website there. But a lot of times there's a deficit, right? There's not enough. And so a lot of therapists have caseloads over capacity or at capacity full of people with problems that they're also not that familiar with treating, right? It could be, for example, someone who usually is really, really great at treating patients dealing with depression, but has a client with an eating disorder on their caseload. Now, the problem comes in where you don't just want to turn that person away, which is the mindset that a lot of clinicians have, or you have to meet certain quotas or expectations of you in the workforce. So at your particular place of work, if you're not, a private practice therapist or anything like that. Now, some people might say, okay, but they have care teams. They're supposed to be meeting. If you don't know this, they're supposed to be meeting, albeit weekly, to talk about their different cases, get the help that they need so that they can gain that experience. Okay, but what I want more clients to understand is that it's important to be very, very active, proactive, informed, ask questions about your treatment because it's your treatment. Because sometimes in the midst of that process of them trying to get the help that they need, or a lot of times it's just not considered to be as much of a problem to them because they just keep talking to you week after week